So my name is David. I'm a final year medical student, and I'm going to be taking the lead on this session today. But I'd just like to introduce James, who is currently an F1, and he's going to be also chipping in and giving us some of these uh, uh, pearls of wisdom.
Hopefully, anyway.
So we're just going to kick off. We're a little bit behind schedule, but that's not an issue. So, like I said, my name's David. I'm a final year, and I'm one of the tutors for MedScore, and I'm going to be taking us through the medicine slash dentistry interview course. And so this is just going to be a general overview of kind of, the broad understanding of things we need to be taken into consideration when it comes to preparing for interviews, when it comes to understanding what content is going to be on there, looking at some ethical things as well. But it is very, very broad. It's not in a lot of detail. So if you do want more detail, your best bet would be to sign up for the course that we're doing. That's coming up soon, that we're going to talk a bit more about at the end of this presentation. And then you get a booklet with more details and kind of a workbook to go through. And then you have obviously the course itself on the day. But before we go any further, I'd just like to, point you to the accreditation section. I just want to give credit to everyone who was involved in actually making the presentation. And it's been a collaborative approach, just to put the credits out there. All right, so moving straight into it. So what we're going to look at today is we're going to look at the types of interviews that we have in terms of structure and content. We're going to look at preparing for interviews, medical ethics, and kind of how that is one of the important bits of the interview. We're going to look at interview techniques. We're going to look at some top tips we have for you and some pitfalls. And James is going to be chipping in as and when he feels like is appropriate, if there's anything I'm missing out or if there's anything he wants to elaborate on. So firstly, we're going to look at the types of interviews. So what kind of structures do we have? Well, we know that we have panel interviews. I'm sure many of you are aware, and also the MMI, multiple mini interviews as well. So to start off with, panel interview, just general overview is about 20 to 30 minutes, depending, might be longer, depending on what institute that you're going to. One thing you'll hear me say through this entire presentation is research, research, research. So you're going to need to do a lot of research into the universities you're applying to, the medical schools you're applying to, what's good about them, what's not good about them, what type of interview strategies do they use, what type of things, key things are they looking for in personal statements and interviews and things like that. So you're always going to need to be researching specifically into the various institutes that you're applying for, whether that's dentistry or medicine. So yeah, as I was saying, so you normally have 2 to 3 interviewers, it may be more, depending. It's the same people through the whole interview. So it's really important that obviously you start off strong and you finish strong because you're with the same group of people, and you don't really get do-overs. So it's important that you maintain your composure and that you don't get flustered during the session. On the other hand, we have multiple mini interviews, which it normally consists of about 6 to 10 stations. It's about an hour to an hour and a half, again, depending to your research. Short interview stations with different evaluators, so they're normally about 8 minutes long. And each interview is a brand new slate. They don't talk between each other, people don't ask, how did this person do? It's all a fresh, clean slate, which is really good. So if you make a mistake in one station, you can just brush it off, leave it at the door. And as you go into the next station, as you go into the next station, you have a clean slate. So some of it will be spoken, written, some of it could be role play. It looks mostly at theory, situational judgment, and scenario-based stations as well. Is there anything you wanted to add at this point, James?
No, I think just probably reiterating what you're saying about preparation. As somebody who's interviewed on the panel now for about 3 years, you see straight away who's prepared and who hasn't prepared. That comes across within the first 30 seconds, it really is worth just putting the effort in beforehand to find out, as you say, a little bit about the medical school, the city, and obviously all of this stuff that we're going to go through here a bit broadly here today as well.
Yeah. And so I've just seen in the comment section that somebody's asked about alternative interview methods. We will kind of touch on that a bit. Everything is still a bit up in the air about how things are being done, but we will look at maybe some differences between, you know, panel interviews, MMI interviews, and also what they may do online as well. But in essence, the fundamentals don't change. Your answers shouldn't need to change, because it's the same principles that we're applying, whether that's online or in person. So moving on, we're going to look at the content of interviews. So the main things that they really are looking for, things like communication skills is huge. They're looking at teamwork, they're looking at empathy, they're looking at cultural sensitivity, they're looking at maturity, reliability, how well you handle yourself under stress. So sometimes you might get stationed, especially in MMI, where the interviewer might be a little bit more mean to you, and it's just seeing how well you handle yourself if you get flustered, if you're under stress. How well you handle calculation and orientation, and those may tie in more into dentistry interviews. So kind of looking at the stations and the type of questions. So again, overall themes. In terms of specific questions and specific stations, we'll be looking more into depth in those a little bit later, but mostly that's going to be covered in the course. So again, just an incentive for you to get involved with that. And so the type of questions they're going to ask you, why medicine or dentistry, that if you need to know that, that's your bread and butter. You need to know why. That's a question they can ask you very easily. They can ask you questions about why this profession as opposed to nursing, for instance, or any other healthcare profession. And you need to highlight those key things that differentiate or separate. One of the main things being leadership. You know, as a medic, you know, you're going to have more leadership and final responsibility roles in the healthcare field. So that's maybe something important you want to highlight. And also, how do you decide who gets the transplant? So that's a classical ethical question they may ask you. Or, you know, two people came, one's a younger girl and the other one's an older gentleman, and they both need a liver transplant. What can you do? How do you decide? And then you have to weigh up the pros and cons. Describe a time you used teamwork, or they might ask you about questions about current affairs, you know, COVID-19, that's huge right now, but we still have other affairs going on, you know, NHS staff shortages, especially in light of COVID-19, the aging population, again, all these things that are key things that you need to be up to date with, you need to be aware of when preparing for your interview. And then MMI stations, various stations such as role playing, situational judgment, personal statements, communication skills, like I mentioned earlier, and manual dexterity for dentistry. So they might have a actual test where you either have to floss, some fake teeth, or maneuver with some equipment, figure out how to use some equipment. Again, really, really important. And we'll link some resources at the end that you can use to do your research, but also look at the universities that you're working with and the medical schools or dentistry schools that you're working with. Yeah, so anything else you wanted to add, James?
Yeah, I suppose just to kind of add on, like obviously each MMI station has its own particular theme, but there's a theme that runs through all of them, and that's communication skills. Now, I don't know the ins and outs of every medical school, obviously, but the one that I've been affiliated with and doing the interviews, you get tested on communication skills in every single station. So no matter what, it could be, you know, a role play one, you're always going to be tested on communication skills as well. So it's good to be really hot on that area, really.
Yeah, I agree. And I've got a question here that's talking about, will some of these questions on the panel be used, can they be used in the MMI stations? 100%. The only difference is obviously the panel discussion, the panel interviews are running conversation, whereas the MMI is just clean slate for each question, each theme. But as James mentioned, communication, verbal and non-verbal, is going to run through the whole thing. I think somebody else also asked what time. So we're aiming for about an hour. So we've got about 15 minutes left. So it will be a bit of a whistle-stop tour. But like I said, please, please, please do make use of the course that we're running. So if you want to get involved with that, please sign up to that. And yeah, we're definitely going to be going into a lot more detail on that. Moving on. So things in terms of preparing for your interviews, things that you need to be doing, taking into consideration. First of all, one thing I always like to say is common is common. So the things that come up in interview and have come up in interviews in the past are most likely going to come up in interviews again. You know, why medicine, why dentistry is classic. You need to know why you want to do that. That's really important. You need to have some answers to those questions. You want to basically look at those frequently asked questions, write them out, and then write some bullet points to kind of script an answer. It's really important that you don't just write a full answer, because when it comes to the actual interview, you're not going to have it all memorized. You're going to be flustered. You're going to be nervous. Your palms are going to be sweaty. You're not really going to be able to focus on, you know, reciting exactly what you said. And also, if you sound like a robot, it also sounds very disingenuous. So you're not going to come across as confident as you need to be in delivering your answers. So bullet point your script, and kind of just so that you have those as ideas in the back of your mind when you're answering these questions. But you do need to really look at the common questions asked, and those, you can find those anywhere. You can just Google those. But again, please, if you want more in-depth knowledge about that, sign into our course. And then, so there's also this 3 columns strategy that we utilize. So basically, you make a table, you write your experiences, your skills, and how they relate to medicine or dentistry. So you write, for instance, you know, I did work experience at an orthodontist, and then your skill will be, oh, I learned about manual dexterity or something, and how this will stand you in good stead as a dentist. And similar things apply for medicine as well. And like I said, this why medicine question, why dentistry, don't just focus on why you want to do it, but focus on why you want to do it in relation to other healthcare professionals, like I've mentioned in the past, you know. So why are you choosing medicine and dentistry as opposed to any other profession? Also, related back to your experiences, like I said, using this table, related back to your experiences, personal statements, and pertinent skills. So if you look on various university websites, medicine or dentistry, they'll give you a snippet of kind of things they're looking for. So they'll say, for instance, we're looking for individuals or applicants who demonstrate communication and teamwork skills and show leadership in their profession. And those are kind of highlighted areas that you need to be really targeting them when you're talking about, when you're preparing, and when you're also talking about your experiences that are going to involve teamwork, communication. If you have an experience that involves communication, you are not going to go wrong. And also your personal statement, really know your personal statement well, because they could very well ask you questions on your personal statement. In the panel interviews, they are highly likely going to just have your personal statement right in front of them. They're going to, pardon me, they're going to go through that. And so know your personal statement well, know what you did, be able to expand on those things. Yeah, and like I said before, know your institute as well. You know, what are they looking for? What are they known for? You know, are they known for, I know Leeds is known for pro sections now. They don't do full dissections now, but they do pro sections. So, you know, Leeds is known for pro sections. Is that something you want to get involved in? Do they have, you know, problem-based learning? What is their curriculum looking like? You know, do they allow for a lot more self-directed, self-regulated learning? So look into these things, because these are things that you can pull up in your interview, whether that's MMI or panel interview, that really show that you've done your research, show that you're going into this not just haphazardly, but because you're being intentional about your decision and your career path. Finally, look at the GMC or GDC for dentists to kind of, again, ascertain more about the career, looking at some of the principles, and also staying up to date with the latest news that they have on there. And like I said, read research papers and current affairs. Those are really key, and they'll help you just have something relevant to say. And again, shows interest in the profession. And then during the interview, just a few things. Stay calm. Easier said than done. I'm sure James will attest to that as well. Easier said than done. But try your best to stay calm, stay confident, because from my experience, overall, they do want you to show the best of yourself. They are trying to pick the best candidates. So if you show the best of yourself, that's what they want. So they're not going to deliberately try and make you fail. They might grill you a bit, but then again, that's part of the testing process. Read the stations carefully and read the questions carefully, and make sure you're actually answering the questions you're asked, especially in MMIs, where each station is different. So make sure you're reading the questions carefully, understanding what they're asking you for, and answering the question. Don't answer lots of things, but don't actually address the question. Make sure you're actually focusing your conversation on the question asked, because that's what they're marking you on. They have a mark sheet in front of them, and that's what they're marking you on. Talk through your process, so especially when it comes to ethical scenarios and things. Talk through your reasoning, because again, that shows that you're exactly that, thinking through things. They can't read your mind, so they want to know, how you get into your conclusions. Take pauses if you need to. Don't feel like you have to just ramble on. Oh, I've got to, take your time, take a breath. If you're not sure how to answer a question, just say, please give me a moment to think about it, and take 30 seconds and think about your answer. It feels like eternity for you, but I promise you, to the interviewers, it's 30 seconds. It really is 30 seconds. So take the time you need to formulate your questions well. Ask for clarification if you need to. Balance your arguments. Don't just do word vomit. So like I said, pause, take your time. Watch your body language. So things like eye contact, smiling, posture straight up and not slouched. Don't twiddle your thumbs. Don't over exaggerate. Your with your hands and things like that. So keep your composure, and that will depict confidence as well. So when you're answering questions, especially in a panel interview, you need to be aiming for about 2 minutes per answer. And then if they need you to elaborate on that more, they will let you know. So your main aim basically is produce clear, persuasive, and genuine answers. You want to come across as genuine. You want to come across as you've thought through things, so you've balanced your arguments, and you want to come across clear as well. James, anything to add there?
Yeah, just I suppose to add that it really is quite obvious when you're kind of sitting on the other side of the desk who has sort of reflected on a scenario, to talk about, for example, a quality of a doctor or quality of a medical student, as opposed to somebody who hasn't put any thought into it. And again, just to reiterate, like if you do need to take sort of 30 seconds or whatever and think about things, like that's completely fine. Like the really, really best people, the best candidates will just go in and be really friendly and have everything just like that. But it's completely fine if you have to take 30 seconds to sort of think about things or think about how you're going to word things.
Yeah, completely agree. And it really does show. Somebody asked in the group chat, if we've prepared, will they know? Again, if you're just reciting off a script that you've written, is very obvious. So it's not really about reciting off a script. It's making bullet points so you can think through, to kind of just give you like checkpoints when you're speaking. So, okay, I need to also talk about this. Okay, I also wanted to talk about this. But if you fully script it out, it becomes a bit obvious, and then you sound a bit robotic. I wouldn't say, I can't tell you outrightly whether they'll reject you or not. I don't think that's how it works, but they will be marking you. So if you come across more genuine, probably going to score higher marks. Anyway, moving on. So these are some of the buzzwords when you're answering your questions you want to consider. These are, key buzzwords. Firstly, empathetic, use empathy, demonstrating empathy, compassion, sensitivity, maintaining patient dignity. That's a big one. Patient-centered care, another big one. Confidentiality, and we'll talk a bit more about that later. Self-regulated learners. Reflective practice, really important, really important. Adaptability, work-life balance, and the list goes on. This is not an exhaustive list, but these are some key ones that you can really focus on. You can also talk about time management, and you can talk about leadership as well. But these are just some of the key ones that we're looking at. So people are kind of talking a bit about the questions that they may ask, and we'll get into some of those in a minute and some tips on them. In terms of right or wrong answer, which somebody asked, there's not really a right or wrong answer. You just need to make sure that you're providing balanced arguments when it comes to ethical decisions, which is what we're going to go on to now. So in terms of medical ethics is defined as the analytic activity in which the concept, assumptions, or beliefs, attitudes, emotions, reasons, and arguments underlying medical moral decision making are examined critically. That's just a fancy way to say that things in healthcare that are tricky, that you need some principles to figure out. That's basically all it means. So we're going to go through a few things. First of all, we're going to look at the 4 moral principles. 4 moral principles are autonomy, beneficence, non-maleficence, and justice. Autonomy is the respect of somebody's right to make a decision for themselves. Beneficence is to do good, and non-maleficence is to do no harm, and justice is to act fairly and give everyone an equal opportunity. And each one kind of has their place. Sometimes each one of them, they conflict with each other. For instance, beneficence could be looking at doing what's in the best interest of a patient, but still acknowledging that. How do you acknowledge their autonomy if, for instance, they decide they don't want a certain treatment? So which is where the next section comes in, which is the 4 Cs: confidentiality, consent, capacity, and competence. So confidentiality, you want to know a lot about confidentiality. You want to know the various areas where it can be applied. You want to look into the GDPR regulations that were updated. You want to look at, there's some key areas of that you want to have a look at. There's a really good website, NHS website, that actually has ethical scenarios to go through, ethical dilemmas, and ways to navigate those as a healthcare professional. If it's not linked down below, I will get you that link after, but it's really comprehensive and it's really good. I highly recommend that. Consent, obviously looking at age of consent, looking at various areas where consent can be broken, things like, if the DVLA needs to get involved or if it's criminal activity, and navigating those. What is the process in which you would go through and to get to a point if you needed to break consent. And also looking at guilt competence in that instance, which ties into competence as well, and seeing whether somebody has the ability to consent for a thing. For instance, if they're minor, guilt competence and Fraser guidelines would come into play there. And then capacity, you want to look at capacity in general, understand the definition of capacity, and also look at mental health capacity act as well. You want to look at that as well, just to give you again an overview, so when you're structuring your questions you sound like you know what you're talking about. Next, some of the ethical viewpoints and scenarios. Virtue ethics, deontology, and consequentialism. Each of them take on kind of different approaches to ethics. Virtue ethics is more just about trying to be a good person. Deontology is looks at the rules, and basically the rules is what justifies an action. So have you followed the rules or not? Consequentialism, on the other hand, quite the opposite, says basically the means justify the end. So you're looking at how many people does it benefit, and if it benefits the majority of people, then it's probably the best course of action. And then some of the ethical scenarios or situations that you might be asked about are euthanasia and assisted suicide. So again, having balanced arguments for these things is really important. So on one hand, one could say autonomy. Autonomy comes into play, helping people if they have the capacity to make that right decision. On the other hand, beneficence and non-maleficence comes into play about assisted suicide and things like that. Gaelic competence and phrasal guidelines, as I've mentioned before. Looking at the GMC and GDC principles will help you as well in terms of formulating, understanding what the healthcare sector, what their prescribed approach to certain scenarios is. Really important to look into. Again, mental health capacity, patients refusing treatment, or the unconscious patient scenarios that you want to familiarize yourself with, and also think about pros and cons, balanced arguments. I've said balanced arguments a lot of times, and that's because it's really, really important. Again, it's not about whether you have a right or wrong answer, but it's about whether you've shown maturity in your answering by providing a balanced argument. Is there anything you wanted to add there?
Yeah, I think probably just reiterating what you're saying about balance. I think, the ethical scenarios are designed so that there isn't a clear-cut answer. They're designed to kind of make you think about the rights and wrongs of either side of the argument, whether it's about organ transplant or whatever it is. And so if you just show an awareness of being able to say, well, on the one hand, there's this person who deserves it for these reasons, but on the other hand, there's this person and they've got kind of these reasons in favor of them. It shows that you've thought about it. Like these aren't easy scenarios, and these kind of decisions are made by really senior level people in hospitals. And so I think just having awareness of that, you don't have to sort of be the master of it, but just show that you have an awareness of both sides.
Yeah, completely agree. And to kind of just follow on from what you've said, I think also when you're structuring your answers, it's really important that you highlight that this is not a decision you'd ever make by yourself. You'd always want to, look at a multidisciplinary approach, especially with some of the more complex cases. You'd want to ask your seniors, talk to your consultants if you're a doctor, ask your colleagues, whilst maintaining confidentiality. So whether you make it a hypothetical patient or you ask the patient whether it's okay for them to share that information. So you wanna know, you wanna structure your answer in that sense. So you'd say this is a difficult situation. Some of the key things that I think I would like to highlight and make sure that I'm taking into consideration are autonomy, and also beneficence and non-maleficence. And then you'd list your arguments, pros and cons, give your balanced arguments, and then you'd say, ultimately, though, I realize that as a very complex decision, I would want to take a multidisciplinary approach, or I would want to take a group approach in which I enlist the help of my colleagues or escalate it to my seniors for advice. And then this again shows, your understanding of your own limitations, the importance of teamwork, the importance of knowing when to take initiative and also knowing when to refer on. So again, it begins to build a more mature response, which is what they like to see, and it's what's on their checkboxes when they're assessing you during the interview. Yeah, so somebody's talked about a different set of 4Cs, which is interesting. So they talked about competency, communication, compassion, and convenience. That's interesting. Haven't heard that 4Cs myself, but those are all things that are important for doctors to have, and in terms of fostering patient-centered care. I mean, I don't know if you have anything to say to that, James. Competency, communication skills, compassion, and convenience.
I suppose maybe create 8Cs then in total, is it? Or I mean, listen, I think if you're preparing for an interview, I think it's good to have an awareness of all of this, really. I think being as broad and having a knowledge as broad as possible going into this is definitely going to help.
Yeah. Moving on to interview techniques. So the main technique I want to talk about today is just your STAR answer structure. STAR stands for situation, task, action, result, and reflection. So they'll ask you, and the interviewer will ask you a question, and this is how you kind of want to organize your answers. So first of all, talk a bit about a situation. So talk about the context, where, when, just one sentence, but be specific. And then you kind of talk about the task, what you had to do, what your role was, and what kind of the pros and cons of your role was as well. You may want to include that, you may not, depending on whether it's relevant or not. And then you want to talk about the action, what you did and how you did it. So a specific action that relates to something you're going to talk about. So for instance, if they ask you a question, oh, could you tell us about a time you mentioned in your personal statement that you did this? Could you tell us about how that helped with your communication skills? So you just say, okay, I performed some work experience at a hospital where I was, well, I volunteered at a hospital, for instance, where I had to talk to patients and provide them with teas and coffees and just make sure they were comfortable and keep them entertained. And then, so that's, the situation, that's your task. The action was, there was a time when I spoke to one of the elderly patients and they found it difficult to communicate. So I had to speak slower and I also had to make sure I was listening more carefully. And then result is what you've learned. So I understand I've further developed my communication skills, understand the importance of listening as a skill, as well as speaking, and making sure I'm tailoring my communication to the patient I'm talking to. So, like that again is the result and a reflection. What you've gained. How does this experience correlate with the skills being asked for, and what would you do differently, or what would you improve on? How have you improved? So, like I said, I further improved my communication skills. And then you could then relate that back to medicine and say, and I know this is important because I understand how paramount it is for patients and doctor communications to be good because in order to maximize or optimize treatment. And again, what you want to really be doing is using a lot of these buzzwords. They have tick lists with buzzwords. So, think about your buzzwords, how to seamlessly introduce them into conversation. Don't just start whacking tons of words in because that's just going to seem rehearsed and disingenuine. So you want to be, really reflecting, thinking about, especially when you're structuring, what experiences you have, what skills they're looking for, and how this relates back to your to medicine or dentistry. Be thinking about some of the buzzwords you can insert in that as well. Do you have anything to say to the structure, James?
I mean, I think just generally, I think there's two things for me that are really, really important. And I think one you've kind of already touched on is number one, like back up each statement that you come out with. It's very easy to kind of sit there and say, yeah, listen, I'm a great leader and I'm really confident and I'm really good at all these things. But if you don't give examples that show a time when you've demonstrated those, then you're not going to get many marks for that. And so I think a really good thing is to just get a handful of qualities of a doctor, so it can be kind of any of the most common ones, and just have an example ready or a story ready to be able to say, listen, I used to sort of go to the hospital and I did this and it showed me the sort of compassion needed to interact with patients or blah, blah, blah. But just have some sort of a story or an example ready for each quality. And then it's not just you kind of blindly saying, yeah, well, I'm really confident, or, you need something to back it up. And I think, secondly, as well, and this is really, really important, is if you think about the person who's marking you for a second and they're sitting there and they might have, 20 or 30 people telling them very similar stories. If you can try and make your story a bit unique and use your kind of unique life experience, it makes a huge difference. You sit there and you've got, 29 people telling you about Duke of Edinburgh and then one person telling you something slightly different. It's massive. And I'm not kind of rinsing Duke of Edinburgh, it's great and all that, of course, but if you use kind of slightly unique, like I had a guy and he was telling me all about Duke of Edinburgh, and very nice, kind of very average, nice answer, and then towards the end, he was telling me about how he was a physiotherapist in the hospital for 3 years, and I was like, how are you not talking about this? That should be the first thing you're coming out with. So just have a think about the things you've done in your life and try and relate those to the qualities. Like, it doesn't necessarily always have to be the kind of standard go-to things that everybody else has done. If you make it a little bit unique, use your own personal experience, it really makes a difference then when you're talking about it.
Yeah, I completely agree, James. And I think I think people often get caught up in thinking, oh, I have to talk about medicine or I have to talk about dental experience. But actually, I know for my personal statement and then what I talked about in my interview, I had been playing basketball for a very long time. So I just talked about that. I was on the basketball team. I had, I was the captain of the basketball team and we won Team of the Year. So in that, I could talk about teamwork, I could talk about leadership, I could talk about communication, and just all these buzzwords just from that experience. And it's not a medical one, but it is a transferable skill. That's another thing we need to realize, that a lot of these skills are transferable skills, and they're important to understand that it's beyond medicine. So you can use examples beyond medicine as well. And also, I think it makes you a bit more comfortable as well when you're answering your questions, because it's your own lived experience. It's what you've gone through. It's what you actually experience. Whereas if you're talking about, oh, I did work experience, in the back of our minds, we all know when we went to that work experience, we didn't have a clue what was going on. Half of the time, we didn't understand half of the jargon they were using. They had all these, oh, we're gonna have, take a FBC, and you're like, what's an FBC? I don't know what that is. So half of the time we weren't paying attention. We were just trying to keep up. So in terms of what you've learned, you might not actually have drawn as much out of it, and it might not have been a personal or an impactful an experience for you. Whereas things that are real to you, things that are personal to you, but not necessarily medical or dental, you might be able to draw more out of them and feel more comfortable talking about them as well. All right, so just a few more sections now. So we're talking about the pitfalls and some top tips as well. So first of all, some of the top tips: be punctual. Obviously, if you're showing up for a panel interview or NMMI in person, be punctual. Dress to impress, so dress well, dress smart, dress professionally. First impressions are vital. So if you're coming into a panel interview, introduce yourself, smile, look like you want to be there, look like you're excited to be there, which kind of ties into passion and enthusiasm, which I talk about a bit more. Shake their hands if that's appropriate. Make eye contact. And then the next one is know your personal statement. I've mentioned this before and I'm mentioning it again. Know your personal statement, because they could easily ask you questions on there. And if you've lied about anything or you don't know what you're talking about, it's going to just be obvious in conversation. Because again, you might be able to, when you're rehearsing, think about a really nicely scripted way to talk about something. But when you're in an interview, you're nervous, your mind is racing at 100 miles a second, you've got a lot going on in your mind, and it's very hard to manufacture things. Whereas if you know it and it's personal to you, or if you've practiced, then you're just going to be a lot more comfortable talking about it. And then, so this one I'm going to talk about in a little bit later: good setup, internet webcam, etc. I'll talk about it in a second, because I want to have a little snippet about COVID-19 and some changes that might be made. So yeah, if in doubt, ask. And like I said again, practice. So with COVID-19, so obviously there's some institutes that usually did MMI, but in order to promote social distancing, they've switched it to a panel interview. Again, the principles we've talked about today and what we'll cover in the day course are going to be the same, regardless of whether it's MMI or panel interview. The general principles of structures, the general principles of themes that you want to be considering are going to be the same. The only difference is they won't be an acting station, obviously, in a panel interview, but the majority of the other things will be very, very, very similar. So what they may do, and again, I'm not entirely certain, because everything is still very much up in the air. A lot of people are still figuring out how they're doing interviews and things like that. But what they may do, and what I've seen some medical schools do, is actually have an online interview session. So you want to have a good setup for your online interview session. You want to make sure your internet is on point. Test your webcam beforehand, so that if there are any technical difficulties, it's not coming from your side. But everything still applies. Dress well, be punctual. Your first impressions are still vital. Smile and make eye contact. be passionate in your responses and make sure you're practicing. It doesn't, because they can still see you, so there's not too much of a difference between the two. Again, I would implore you guys to go on the specific places you're applying to and look at the latest news and what they're doing. They will always release statements about what their interviews are going to be like. They're not just going to toss you into the dark and tell you a day before, oh, it's going to be a panel interview, by the way. No, they're going to have information on their websites. So check those out. If you can't find them, email. They always have a contact. So email somebody way ahead of time and they will get back to you. It doesn't hurt to be overinformed. There's no such thing. So get as much information as you can to prep. Don't overwork yourself. Don't overworry yourself, but make sure that you're informed enough to be comfortable and at peace in knowing that you've done what you need to do to prepare. Any other top tips you have for us, James?
Yeah, I think it's important to kind of realize that everybody is going to be nervous, you know. And I think one of the things I really sort of kept in the back of my mind was, at the end of the day, it's just a conversation, you know. Like you're sitting there and you're talking to somebody about something. And if you kind of keep this in the back of your head, it kind of makes the entire thing, I think, much easier, you know. It's nothing sort of groundbreaking, like you're sitting down and chatting to somebody, or maybe I suppose doing it over Zoom or something like that. But you're literally just having a conversation with them, and they want you to do well as well. And I think that's probably, I know you kind of mentioned it earlier, but like all of the examiners do want you to do well. You know, we're just kind of there to try and help you through it. Again, as you said earlier, you know, we might ask you questions and sort of challenge you on things, but that's all part of the process. And you know, nothing is kind of personal or trying to kind of take anything out on you or anything like that. You know.
Yeah, completely agree. So I'm gonna move to some of the pitfalls, some of the reasons why people don't quite do as well as they wanted, expected, or should have done. So lack of preparation. Again, if you don't prepare, you're just not going to be able to come across as mature and balanced in your arguments, in your discussion, or as thought through in your discussion. Um, you know, detail about your personal experiences. So if you're very vague, you're not gonna again come across as having actually put in the time and work to gain insight into why you want to do this career. Knowledge on current events, COVID-19, know about it. Please, 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 please. If you don't know, you need to know about it. They're gonna definitely. There's high likelihood that they may ask you about it, and it might not necessarily be. Don't quote me on this, but it might not necessarily be, oh, what do you think about COVID-19? It could be with the challenges that were there before COVID-19. For instance, staff shortages in some hospitals or some wards. What do you think the impact has been with COVID-19 being introduced? Or they could ask, with the aging populations, what are some of the risks and what are some of the things that can be done to alleviate these risks? These are types of questions they could ask you. So don't just know about COVID-19 in general, but also know about the impact on the healthcare service more specifically. Because again, you're applying to be a healthcare professional. So know about its impacts on healthcare. And you can do that by just looking at recent articles, journal articles about COVID-19. You can do that about looking at GMC guidelines or GDC guidelines, and they'll be able to help you with that. And then knowing the policy regarding the healthcare system. So understanding maybe what's private, what's free. I know dental care is not free, and I'm pretty sure anything optometry is not free as well. So just knowing what's free, what's not free, sorry. And just knowing the general policies. Again, look at your GMC, look at your GDC principles and websites for that. Inability to balance arguments. So if they ask you a question, whether it's an ethical question or just a general question or a reflective question or about your personal statement, and you're given a very one-sided answer, you're going to lose marks, because on the mark scheme, part of it is being balanced in the argument you're bringing across. So it's important to make sure that you are bringing in balanced arguments. And then poor body language. So if you're crouched over, if you're twiddling your thumbs, looking around, not really looking at them, that is not gonna get you good marks. So you always want to make sure your shoulders squared, making eye contact, smiling. Even if you feel in your mind that you look really cheesy, you look really awkward, just smile. Smiling makes you feel better. Smiling makes the interviewer feel better. Even if they don't smile back at you, sometimes they have a straight face. But if you smile, you'll feel better anyway. And it also breeds confidence. It shows that you're confident in what you're saying, confident in your answer. You don't feel out of place, even if you do in your head. Poor communication skills. So I want to elaborate on this a bit. So poor communication skills is not necessarily like, before I say every sentence, I'm stuttering a lot. It's not just about that. It's, are you listening to what they've asked you? Are you reading the question properly? Are you taking your time? Or are you is the rate of your speech, manageable? Or are you just blitzing through your answer? Are you talking too quickly? Or are you talking way too slowly? And that's not to put in your head that, oh my gosh, I need to make sure I'm not talking weird. It's just talk like you're comfortable. That's all I guess I'm trying to say. And it might be written. So I know in the MMIs, they have written stations. So your communication, what's your written communication like as well? So with communication, it's both verbal and non-verbal. So things you actually say, the content of what you've said, but it's also non-verbal, your body language, your posture, your eye contact, what you've written, and things like that as well. So just be aware of those things. Any other pitfalls you can think of, James?
I think, in fairness, these are probably the main ones. I think it sort of goes back to what I was saying before. Just try and be kind of slightly, I think, unique with what you're saying, because I really can't sort of reiterate enough when you're kind of sat on the other side of the desk and everybody is saying the exact same thing to you. It does get a little bit tiring if you kind of factor in that human element of it, and that's why if you have something, and everybody has something slightly different to talk about, it just takes a little bit of time to kind of reflect on it and analyze it and prepare something for it. But everybody has their own unique experience that they can talk about,
Completely agree. Yeah. Keep that in mind as well. If the interviewer has said the thing multiple times, they might be a little bit less keen to hear about your work experience at a hospital that everybody else has. Not that you shouldn't include it, but just think about how to make it unique and personable to yourself. So I don't know if Chris is on. That's it from me. In terms of the COVID-19 stuff, again, like I said, it's really important. Just do your research with that, and that will help you understand what specific institutes want from you, and also ways that you can prepare for that, whether that's going to be online, whether that's going to be panel instead of MMI, which you initially thought of, or whether that's going to be exactly what you thought of and you can just progress in that regard. But if it is MMI, they might still be doing a lot to do social distancing. So in terms of the rooms and stuff, they might change that up, but they will communicate that with you. All you need to focus on is getting your principles down, because if you get your principles down, those can be applied to any, slight change in scenario. Because again, whether you know the answer to the question or not, if you take a pause before you answer the question, that's going to be relevant regardless, right? Or structuring using the STAR structure, that's going to be relevant regardless. So stick to the principle that we've talked about today. And like I said, if you want to know more in-depth stuff, please sign up to our course day, which Chris is going to talk to us a little bit about. So Chris, if you want to unmute yourself, you can.
Yeah. Thanks everyone for coming in today. We're aware that there's a lot of people who are doing A-level who have attended today's course. So we've decided to create just a small discount for the attendant of today. So we already got a few people who signed up. So yeah. And in terms of the one-to-one service, as there's only a few of us working at the moment, and a lot of the other guys are already doing F1 and F2, so our time is quite limited. So make sure you send us an email or you book really quick, because we already got 2 people who've signed up. for the one-to-one. So we've only got 10 spots available for the one-to-one.
So I think one more thing I just want to say about the event, it's going to be really comprehensive. We're going to go through, practically how to answer questions, practically what ways you can prepare. Whereas this has been very much more theory and an overview. That's going to be a lot more specific and practical. And like we'll be doing one-to-one interview sessions. We will be, going through structures of answering questions in more depth as well, and looking at specific questions as well. So definitely a good shout if you want to.
Actually, if I could just kind of jump in and sort of add to that as well, really. I just really think it is invaluable to get that sort of hands-on experience and go through the motions of kind of acting out like an MMI or acting out the kind of interview process. I mean, there's things worth spending money on, and there's things not worth spending money on, and this is definitely in that first category. There's things, people buy textbooks and all sorts of things. Like, I'll tell you, none of that is really necessary. If you're going to spend money on something, I would say this is definitely at the top of the list. Because you can just see straight away who has gone and practiced this kind of thing. It's a bit like your driving test. It's like doing a driving test without doing any lessons. That's why I think this is just so valuable, really.
Yeah, agreed. And then just a final slide before we conclude today. These are just some resources. If you want to take a picture of this slide, go ahead. These are just some resources that we have here for you. There's some books that may be useful. I would say if you can, just find somebody who has it. Don't worry too much about going out and buying it yourself. But it has really good panel interview and MMI questions. Kind of goes through how to talk about them, and this one is a really good one for dentistry as well. I use this one for myself for medicine, and I highly vouch for it. It's very, very good. And a lot of those questions, the themes came up in my interview as well. So I definitely recommend it. And then these are just some places where you can do further research and get some more information in preparation for your interviews. Like we mentioned, it's really important you're actually practicing. A good way to practice, because obviously the course is just one session. So after the course, go away, or if you don't even attend the course, go away and rehearse answering the questions. Record yourself answering the questions, and that will really help you understand if you're saying too much, or do you know what I mean too much, or just phrases like that. So it helps you, regulate your rate of speech, and it helps you also regulate your content of speech, which is really helpful, and it kind of helps you reflect on how you're answering questions. But that is it from us. You can always correspond through the MedScore email to ask any further questions. I want to give a massive thank you to James for volunteering his time. He's a very, very busy guy. Thank you very much, James.
Yeah, no worries. Are there any sort of questions that I might be helpful answering, or is there anything specifically?
Which one is easier, panel or MMI?
I suppose it depends what you're good at, really. I think first of all, listen, I don't think it's kind of helpful to think in those kind of terms. Like they're two separate types of challenge, but they're very achievable challenges. So I don't think it's kind of necessarily almost very useful to think about which one is easier, which one is more difficult. Someone said, "What's the best way to approach the why medicine question?" I think the easiest way to approach that is whatever way is the most personal way to you. And it does actually take an awful lot of thought and sort of introspection and reflection to look and think, why do I actually want to do this? And being really honest with yourself. And I think if you're able to do that and get that across in an interview, you'll be miles ahead of the people who are kind of saying like, oh, well, my dad's a doctor or my mum's a doctor, and, I've always wanted to do it because I'm good at sciences. And, if you're really honest about why you want to do it, you'll be miles ahead. And I think just trying to kind of be a bit honest with yourself about why you want to do it, definitely.
Yeah, there's a lot about COVID-19. Again, I know I've said it before, I'll say it again. Research. COVID-19, do your research. If you need to email universities, institutions, email them and just ask what is the current, structure of your interviews, considering and they will post something. Most universities will have a COVID-19 section now, so you can just go on there and they'll have more information about interviews and things like that. So it depends, it varies, but they're always going to be panel interviews, MMI interviews. They may be online, in person, but those are the only main two types of interviews that you're going to have. So there's another question. I think this would be the last question, just because I realized time is going. But how much work experience is required? What specifically would matter? That's a good one. Do you want to talk about that one, James?
Yeah, I don't think there's any kind of set, amount of work experience that you need to do. Like ideally, you'd get like a bit of a hospital placement and kind of go and see things firsthand, and maybe ideally you'd kind of see a couple of different areas within the hospital. But we are very aware. Lots of people from very different backgrounds, and some people might have greater access or less access to that sort of stuff. And so that's why, and it's kind of going back to what I was saying before, like if you just really make it personal to you and talk about your experiences, that's really what this is all about. There probably was a time where medicine interviews were tick these boxes, say these things, and that's it. But we've moved really quite far away from that, I think, especially with the MMI type of interview. And it really is just trying to get across, who you are as a person, why you want to do this, why you think you'd be good at this. And it's just about using those personal experiences. And this is, again, going back to a little bit what I was saying earlier, in that, everybody has experiences that can be used in a medical school interview. And a lot of people just don't realize it. The amount of times where I get to the end of the interview and there might be 30 seconds left and I'm just having a chat with somebody and they'll start talking about something and I'm like, why have you not used that as your main example there? Honestly, it happens all the time. That's why I think it's so, so important to just have a little think about the things that you've lived through in your life and how you can relate it to qualities of a doctor or the kind of stations that you might face in the MMI.
Yeah, I completely agree. And I think just to add on to that as well, this is my personal experience now. I'm final year medical student and I didn't have any genuine work experience. And I don't know if that's just shocking to people, but I genuinely didn't have any genuine work experience. I had a lot of voluntary experience. I had hundreds of hours of voluntary experience, hundreds of hours of extracurricular experience and activities, but I had no work experience. Now, I wouldn't advise that, but the situation I ended up in meant that I couldn't quite acquire work experience before I applied. And so it wasn't, again, that's why I always hammer home exactly what James said. It's not about just the experience, is about how you can draw out of it. What skills have you learned? How have you demonstrated a mature understanding of this career you want to go into? And that is the most important thing, ultimately. Get work experience if you can, because it's a big bonus, but don't worry too much about needing 1,000 hours of work experience, with a consultant. That's not the point. It's got nothing to do with the experience. It's got nothing to do with just the experience. It's got everything to do with how you draw out of it and how you demonstrate a mature, reflective understanding of the career you want to go into, whether that is medicine or dentistry. Yeah. So that's going to be it for today. Like I said, if you want to learn more, please do sign up to the events that we have coming up. The course day is going to be really, really useful. And if you do have any other queries, please direct them to the MedScore email and sign up to the one-on-one sessions as well, because they'll be very helpful. Okay, so thanks again, James. Thank you, Chris. And thanks to everybody for listening.
Cheers.